Yeah, so for lower risk, clearly the majority of goals is quality of life, symptomatic improvement. So essentially, if patients are not having symptoms or issues from their disease, the overall paradigm is watching those patients. Now we know that a vast majority of MDS patients do have symptoms. Anemia or transfusion dependence for blood is their biggest issue. And I think the challenge is historically we didn't really have much, and so you kind of lived with subadequate responses. But now we have multiple new approvals, new indications. We have both Luspatercept and now more recently Imetelstat. And so I think we're now going to be much more truly focused on the quality of life of that patient. So a patient's quote unquote responded but had a hemoglobin of 7.5, like that's not really what we're trying. And so I think there may be more combinations or transitioning therapies earlier to really getting the response of, I would say ideally a hemoglobin greater than 10 and not just the achievement of transfusion independence. So again, the main goals are symptomatic based, which is different from the higher risk setting. But now we have more opportunities to make those responses better for each individual patient.